healthcare systems. Last conversation was about systems, how they operate and how they work, where they are and what they are, and how loose they are and how tight they are. But this is about healthcare itself. So clear your mind. Imagine there's no healthcare in America, and you are able to put healthcare in America. How would you do that? What would be the best way of giving healthcare to America? What is healthcare involved? Doctors, hospitals, nurses, maintenance workers, counter servers, waiters. So this big, huge operating system we call a hospital, right? We need those. We know what they are. We know how they work. And we know how big to make them as to how many people they can serve. Or maybe you make them smaller and spread them out across an area so that one can't get overwhelmed or overburdened. And you can share some of these resources and reduce travel time. So you'd look at the whole country. You would wipe out all the states' lines in those drawings because this is healthcare for America. And you'd begin to look probably first by population. You've only got so many gazillions of dollars to spend and so many people able to staff these facilities. So how would you do it? Would you build some huge mega center to worship in the middle of a city for a specific reason? Or would you build healthcare clinics out among the population that support all of the activities that patients need? It's a tough choice because there's a reason for specialties. So now you're going to throw specialties in there. But that's okay because we can think about this. We can kind of plan and look at it. We've got a huge population. And while they don't have health care to speak of, we have huge information pieces that inform us about this. So besides population and saying let's say every 50,000 people get a minor hospital, a small hospital, a urgent care center type of thing, how would you distribute those? Would you let it go to competition so that the best healthcare provider or the one that makes the most money wins? Do they have to be a huge chain run by some corporate piece of thing? They have to interact with some corporate piece of thing because that's what they're going to be. Do they need some god sitting at the top? Some corporate board sitting at the top? Probably need a board of governance well represented by all the humans, regardless of boundaries or political affiliations. This is how you would methodologically decide how to print a healthcare system with your 3D printer. Then you'd throw in other variables in there like risks. What risks are endemic to a particular area? I'm not talking about states. We're talking about places where people live. Nature doesn't know states. Pollution doesn't know what a state is. It can't spell. It just can kill and maim. So people think about these things. They think about them at the highest levels of the federal government. It has been ongoing, this system of how we do things. But then there's the money piece. Some good ideas don't get funded. Some bad ideas do. How can we weed out those bad ideas? Do we shun them? Do we cancel culture them? Let's be silly here. There's some things that we can do a hell of a lot better. Healthcare. So we're going to look at risks. Pollution risks from our own environment, because our own environment can kill us. Pollution risks from being in proximity to a mining operation, a chemical processing operation, a propane plant. There's an example of a mistake made in Texas. But things happen, accidents happen. So do you plan to have helicopters to support life flights into a bigger regional medical center? What does this spider look like? And should it work with the spiders next to it, this spider web of personal health care, where you don't go to your employer and ask if it's okay if you have this procedure? Could you imagine doing that? Hey, doc, I need my, or hey, boss, is it okay if I get a prostate exam? Because, you know, that's kind of what senior folks ought to have. Is it okay, boss? Could you imagine doing that? Guys, go ask your boss if it's okay you can have a prostate exam, okay? Why is he involved in your health care other than he's probably a good person and is concerned about your health? So health care, how hard is it to do better? How hard is it to wipe out the games of profit and corporate avarice inside of this healthcare institution? Oh, good Tuesday morning, neighbors. I hope this is